Hi guys, I wanted to show you my presentation about Bill. I presented this on Tuesday, the 24th. Yeah, that's right. Tuesday the 24th of July, 2012. It was really cool. The presentation went great. So anyway, laryngeal cysts. I'm going to present this as if I were presenting it to like an actual presentation. Like, I'm not just going to flip through and be like, oh yeah, I did this and this and this. I'm going to try to make this a presentation. And since some of you guys may not know exactly some of the specific terminology in here, because I honestly presented this to an audience where they knew what I was talking about. And you guys may not know what I'm talking about perfectly, so I'm going to be trying to explain it as I go along. Okay. Hi guys, this is a presentation about a guy who has laryngeal cysts. An introduction to cysts. Cysts are unilateral lesions. Unilateral means that they are on only one vocal cord. You have two of them, the cyst is only on one side. There are two kinds of cysts. There are mucus retention cysts, which are filled with fluid and caused by blocked ducts. Epidermoid cysts are like calluses. They form on the lamina propria and are due to traumatic overuse and abuse. Okay, so a couple terms here. The lamina propria, your vocal cords are made up of layers. I think there's like 5 layers. It depends on how you classify it, but there's 5 layers through your 2. And the lamina propria is the middle layer. Okay, so traumatic overuse and abuse is self-explanatory, and those are a type of vocal fold hyperfunction. And hyperfunction means that you are using your voice too much and you're using it in the wrong way. Vocal fold cysts cause swelling on the opposite side. So you've got one vocal cord with a cyst on it, and it's bumping into the other vocal cord, which is smooth. Well, having the bump hit it causes swelling. So, cysts don't respond to medical treatment, voice therapy, and vocal rest like nodules and polyps do. You may have heard of the term nodules before, like Adele got some nodules. It was in the news a little bit ago. Nodules and polyps are more common, although cysts are common as well, but it's important to diagnose them differently and not get them all confused. So a way to tell that it's a cyst is that because it's stubborn and that it requires surgery and that it doesn't respond to anything but surgery. If left untreated, a laryngeal cyst will result in scarring and permanent change in the voice. This is no good if your voice is your profession. So, my client is 22-year-old Bill Kaulitz. He is a singer and he talks excessively. He has a high amount of abuse and misuse behaviors. That means those misuses and abuses are ways he's using his voice that he shouldn't be, and things that are not good for his voice. These misuses and abuses include smoking, alcohol consumption, excessive talking, excessive loudness, emotional stress, pushing his voice, glottal fry. Glottal fry is talking like this a lot. Sometimes people talk like this a lot. So it's common among like college-aged females. So, okay. Significantly excessive strain on the voice and clavicular breathing. We're going to get an example of clavicular breathing later on. Also, you may argue that all the hairspray fumes that were needed to get his hair to stand up that high. Man, the dog is annoying. Okay. To get his hair to stand up that high also irritated his voice. So, Bill Kaulitz and the German rock group he's in, Tokyo Hotel, played 43 concerts in a row while doing promotions and interviews on the side. After suffering weeks of symptoms, Bill lost his voice completely during a show. The rest of the tour was canceled. He sought immediate medical attention. So, before I go to the video sample, I'm going to pause the recording and let the dog out, because he's going to be annoying if I don't. Let's see what button I push to get it to stop. This one? No. This one? No. This one? Okay. Dog is taken care of. Let's go see the voice clip. The people who I presented this to don't speak any German, and they're not familiar with any of the songs or anything, so the way this was set up was that they could just listen to the German and not understand what he's saying, but since it was like that, they could listen to his voice and how he was saying it instead of what he was saying. So this is a clip that I showed in class. Listen for the glottal fry and squeezing. Oh, he's so pretty. Look how pretty he is. I mean, look at his clavicular breathing. Okay, so clavicular breathing isn't a normal way to breathe. It's really inefficient, and it's strenuous, and it's just bad overall. You're supposed to breathe with your diaphragm. So anyway, Bill demonstrated clavicular breathing in that video sample. So, also during the presentation, I didn't actually squee on how beautiful he is. I kept that on the down low, although I squealed inside. So, I evaluated Bill, and he reported a lot of symptoms, including hoarseness, pain and soreness, increased effort to produce a voice, fatiguing after using his voice, and losing his voice after use. He also reported a lack of control over his voice, experiencing pitch breaks, delayed initiation when he tried to phonate. This means that when he would reach for his voice and try to speak, that it wouldn't start when he wanted it to start. He also reported reduced pitch range and aphonia. These happened mostly when he was singing. What's interesting about laryngeal cysts is that their speaking voice may be okay, but it's when they try to sing that their voice falls apart completely and you notice that something's wrong. So, perceptually, I listened to Bill's voice to assess it. He presented with hoarseness, aphonia, pitch breaks, diplophonia at higher pitches. Diplophonia means that he had two tones at one time. That's not normal. He also exhibited a decreased pitch range of only 2 octaves when his normal octave range is 4, and clavicular breathing as demonstrated in the video. His maximum phonation time, MPT, was 15 seconds, which was not within normal limits for an adult male. The longest time that an adult male can hold a sound like that, like hold out a note like that, is 30 seconds, yeah. His S to Z ratio was 1, and the S to Z ratio is a measurement that looks at the coordination of the respiratory system and the voice. So, your breath support and then the voice that you can make. The S to Z ratio that Bill had was within normal limits. Instrumentally, I collaborated with an ear, nose, throat doctor to assess Bill's larynx and voice with really fancy equipment. So, a video endoscope is a camera that's shoved in a person's mouth and in the back of their throat so that you can look at the vocal cords. It's really cool, and I would want one done to me so that I could look at my own vocal cords, but